All right, in this morning's Your Health segment, women are getting treated for ADHD more and more. And we learned about the skyrocketing rates among women in a report released last week. To give us more insight into this, we are joined now by Dr. Peck, a clinical neuropsychologist at the Institute of Living at Hartford Hospital. Dr. Peck, thank you so much for coming in so early with us here to talk about this pretty interesting study. They're saying that women are now the ones who are being diagnosed with this. We're so used to hearing about children with ADHD. Now, why do you think it's women being diagnosed?
It's very interesting. If you look at some of the literature going back to the early 2000s, 2002, 2003, we see that there was starting to be a trend where folks were publishing and saying, well, you know, when we actually look at the data, we're seeing that there's different ways that this diagnosis actually presents. So for little boys, we see this ADHD hyperactive type and combined type. But with little girls, for so many years, we thought that perhaps these individuals were not. We thought for so many years that this was the only way it presented, and when we look at females, little girls and the such, we actually see that it presents as more inattentive, which is something that was off the radar.
Okay, so a lot of women, they're so busy, they've got some children, they've got maybe a job, their family at home. You know, a lot of women find life kind of overwhelming, but what are some of the signs of that an adult woman who may have ADHD as opposed to just being kind of overwhelmed and stressed with life? What's the difference there?
So what we see is these individuals probably did perfectly fine going through, perhaps not perfectly fine, but going through early adolescence into young adulthood. But once they hit that 24, up to 36 range in age, they actually have quite a few more responsibilities that are put on them. Perhaps they're working a job now. Maybe they're married, they're in a relationship, they're kind of taking their kids all over the place, and so what we see is that as the demands increase, actually this group is hitting a wall and having difficulties in their relationships, having difficulties in employment and the such, and so.
Right. So talk to your doctor if you think that you might be one of these people who's, just check it out, right?
Precisely. I think going to your PCP and asking them to do just a brief screener, they're not going to diagnose you necessarily, but checking in with them, and then they'll probably refer you for a larger evaluation, such as a neuropsychological evaluation, to look a little more closely and see if that is a condition that you have.
All right, Dr. Peck, thank you so much for coming in. Really interesting information. All right, stay with us. We'll be right back right after this.